article, we review the cancer incidence in patients with membranous nephropathy. Membranous nephropathy is one of the most common causes of nephrotic syndrome in adults, and it has been associated with increased risk of cancer. Hi, my name is Landan Zand. I'm a general nephrologist at Mayo Clinic, Rochester. Today, I will be talking to you about our publication in Mayo Clinic Proceedings in the April issue titled Cancer Incidence and Risk Factors in PLA2R-Associated Membranous Nephropathy. Membranous nephropathy is one of the most common causes of nephrotic syndrome in adults. It has been associated with overexpression of certain antigens and development of antibodies. And over the last decade, there have been significant advances in our understanding of membranous nephropathy. One of the most common antigens is PLA2R. And in addition, patients with membranous nephropathy are known to be at higher risk of cancer during their lifetime. In this article, we specifically decided to focus on patients with PLA2R-associated membranous nephropathy and look at their cancer incidence. Prior studies have suggested that membranous nephropathy patients have 2.2 times risk of developing cancer in their lifetime, but that was not restricted to patients with PLA2R-associated membranous nephropathy. We also looked at the association between PLA2R level, both as a continuous and a binary variable, in addition to developing complete or partial remission and incidence of cancer, and we were not able to identify any association. But we do believe that research in a larger number of patients in a bigger cohort may help address the question as whether or not the PLA2R antibody alone may play a role in risk of developing cancer in the future. So in this specific article, Dr. Vargas will tell us more about our findings.
Hi, I am Maria Vargas. I'm a research fellow at Mayo Clinic. We have 239 patients with PLA2R membranous nephropathy, and we followed them in a median time of 5 years. We found that among them, 36 patients have cancer after the diagnosis of membranous nephropathy, is 15% of the patients. We analyzed the cancer incidence of in these patients having 22 events per mil persons per year. We also compared our incidence with the incidence by the CDC, and we established that in our cohort, after an incidence weight per sex and race, that our patients have at least 4.76, kind of 5 times the incidence of cancer compared with the general population. We also found that these patients, when they were stratified by smoking, we also found that these patients have a higher risk of cancer. When we did an analysis, an univariate analysis of these patients, trying to find which are the factors associated with cancer in these patients, we also evaluated the PLA2R titles with the sex and other factors that are typically associated with the presence of cancer. We found that patients that smoke, also the patients with prior history of cancer, have significantly increased risks of developing cancer after the diagnosis of PLA2R membranous nephropathy.
So our study shows clearly that patients with membranous nephropathy, after adjusting for their race and sex, are at significantly higher risk of developing cancer in their lifetime. And this is really important for practitioners to know, because patients who have membranous nephropathy should be monitored very closely and undergo age-appropriate cancer screening in order to detect any cancer that may develop during their lifetime. It also highlights that the risks, the factors that increase the risk of cancer in membranous nephropathy go beyond just age and sex and smoking history, and there are likely other factors at play that we need to get better understanding of in the future.
Finally, we want to invite you to read our article about cancer incidence in membranous nephropathy in the PLA2R antigen. With this new information and with this paper, we want to share with you the new findings in cancer incidence in these cohorts now that we have the antigens available to have specific information per phenotypes in membranous nephropathy.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.